We're hoping to bring some of the, rigour of the clinical trial design and conduct that's been developed over 20 plus years to this area and really try to help advance the application of psychedelic assisted psychotherapy. So we've been doing some studies exploring the effects of psilocybin and the active ingredient in magic mushrooms and MDMA, which is more commonly known as ecstasy. We've been conducting studies exploring how they affect the brain in healthy individuals. We're conducting studies in depression and in obsessive compulsive disorder as well. My name's Professor Paul Fitzgerald. I'm the Director of the School of Medicine and Psychology at the Australian National University. In that role, I'm a senior academic leader, but I'm also a psychiatrist by background and a psychiatry researcher conducting a variety of research studies exploring novel treatments for psychiatric conditions like depression, obsessive compulsive disorder and the like. I suppose the most important one was having an exposure to psychiatry research during my initial clinical training. I was fortunate enough to work in an environment where being engaged in research was encouraged and facilitated, and I was able to conduct a small research project and start to understand really the degree to which conducting research with individual patients sort of at the bedside, so to speak, although I was actually seeing patients in their own home at that time, really could influence their outcomes, but also hopefully, affect and change the field. I then went overseas and did a fellowship in Toronto, where I had the real benefit of working in a sort of highly productive and very intellectual environment where the way in which new research was conducted, but also new knowledge was analysed and thought about, was really quite inspiring and drove me to really want to establish a substantial research career alongside my clinical work when I returned to Australia. Most of the research I do is focused on developing new treatments for mental health conditions. We currently have two main programs of research. The first is continuing a 20-year program of research evaluating novel forms of brain stimulation, particularly transcranial magnetic stimulation and a technique called transcranial alternating current stimulation. These are forms of non-invasive brain stimulation that can change brain activity and have therapeutic benefits in conditions such as depression and OCD. And so we're continuing to conduct clinical trials of refining and developing these methods. In parallel with that program of research, we're conducting a number of studies looking at the use of new forms of psychedelic assisted psychotherapy. This is a bit of a sort of an area that's boomed in recent years, and there have been a sort of an explosion of research internationally. And we're hoping to bring some of the, rigour of the clinical trial design and conduct that's been developed over 20 plus years to this area and really try to help advance the application of psychedelic assisted psychotherapy. So we've been doing some studies exploring the effects of psilocybin and the active ingredient in magic mushrooms and MDMA, which is more commonly known as ecstasy. We've been conducting studies exploring how they affect the brain in healthy individuals. We're conducting studies in depression and in obsessive compulsive disorder as well. We have a variety of partnerships to ensure that we can do this research. That includes obviously the agencies that fund us, which include government agencies such as the NHMRC and Medical Research Future Fund, as well as private donors and other philanthropic sources of funding. We also have partnerships with a range of clinical services and other academic organisations around the country and internationally to ensure that we can do the research that we want to do. We partner with hospitals and other health services around Australia, to act as translational partners to ensure that the treatments we provide get out to patients as quickly as possible, but also as sites where we can recruit individual patients. We work with other academics to establish sites to conduct our research around the country as well as internationally. We have a very strong partnership with the University of California in San Diego, and with them we are conducting several large clinical trials both here and in the US to ensure that we can recruit substantial numbers of patients and meet our trial objectives in the most efficient ways possible. Really, most of the things that I get excited about in the clinical research that I do come from my experiences in clinical practice. I've been a practicing psychiatrist for over 25 years, and I see patients all the time who are just really struggling to get better. We've done an enormous amount of work in Australia to reduce the stigma associated with mental illness, to encourage patients to come forward and discuss the mental health problems that they're experiencing, to get access to treatment. But we've done far, far less to actually provide those patients with the sorts of treatments that they need to actually get better. And patients need access to better therapies, and that's really what drives me and what drives the research that I do on a day-to-day basis. I like to do a variety of things outside of work. The majority of those are in the outdoors. I like to hike, I like to ski, I like to windsurf when I get the opportunity. When I'm not being able to take advantage of the wonderful environment around Canberra, I dabble in a little bit of painting. I'm trying to learn to play the guitar again. And I just, have the usual enjoyment of catching up with family and friends.